Hello everyone, welcome once again to Nyaniao Health. Today we'll be talking about chronic obstructive pulmonary diseases and what we can do to prevent them, and if we do have them, what we can do to kind of make it easy and help our body, that is our immune system, to get much better. As you can see there on the screen, we have a picture of healthy lungs, infected lungs, and there is chronic bronchitis and emphysema. Chronic bronchitis is whereby the lungs affected. Most of the time these things are caused by smoking. It could be due to other particles, but mostly it's due to smoking. So when you look at it, the chronic bronchitis is whereby these 4,000 chemicals found in the smoke, they actually inhibit, many of them are toxins, they inhibit the celiac, which are kind of small particles like hair, like in our lungs, to have the ability to be able to move the mucus out. And later on we find that there's so much mucus just in there congesting in the lungs, and that induces the whole coughing thing. Whereas emphysema, it's kind of a little bit different, because on the side of emphysema is basically the alveoli, the small air sacs, damaged to a point of no repair. And in 2019, the World Health Organization did discover that these respiratory diseases, which are often called COPD, were third leading causes of diseases. Now you think you hear about cancer, heart disease, but imagine this is one of the things that's taking many people before they achieve their dreams, aspirations, and that's why I decided today to actually discuss about this and then see where and what we can learn from this, and what we can actually do as a people to help ourselves get better. Now, as you can see there, I did try to discuss some side effects of smoking on the lungs, and especially with these diseases. Obviously, I wanted to discuss about asthma, but asthma sometimes it actually is in a line of allergens. And if you can see out there, it's like, first thing when that happens as a result of smoking is that it induces the smoker's cough, causes emphysema. Asthma is aggravated by the smoking, and then smoking also causes shortness of breath, as we can see out there. Now, these things are life-changing. Based on this information, we can decide to do something amazing or not so amazing. The other thing that I've actually discovered is that there's a way, if you are actually smoking, you can actually try to stop. But for those who are not smoking, the best way of preventing is just stay away from smoke. Having said that, these diseases are lung associated. You could be sleeping in a room that's moldy. You could be working in an environment that's super filled with so much dust, so many pollens. Those things can also affect your lung health. And some simple behaviors or habits, like spending more time lowered like this, and you are affecting your breathing, you're not breathing in enough air, that is also something that can affect your lung health. You want to expose yourself to things or do things that will optimize your health, and this is why Nyaniao here Health is here to help you understand what can I do to improve my overall health in all aspects, whether it be breathing, whether it be heart disease, cancer, and all those aspects of life. Now, I want to share with you some of the things that happens when you are actually trying to quit smoking. If you are actually have been smoking and you feel like, you know what, this is not for me anymore. First of all, you can choose to stop smoking. No hiding cigarettes. You always have stash of some cigarettes there and here and there. Just remove all that. Engage in deep breathing. Exercise every day. Maybe walking, could be running, whatever type of exercise that you actually find most conducive and helpful. Get more sleep and have water. Expose yourself to water. Drink more water, and more water in and outside, as water is very helpful. Avoid caffeine, alcohol, heavy meals, and heavily spiced things, and avoid high risk situation whereby you go with friends, you know they're gonna offer you that smoke that you have always been craving for. Just avoid that. When you quit smoking, it may be sometimes hard, but actually it's worth it, as these drawback symptoms when you decide to stop smoking. So that's a thing you might want to consider also. So another thing that we want to do is offer you awesome news that have been happening out there in the medical world. So some professionals did seek natural solution to this. So they are trying to look at the scientific ways of making the whole COPD treated using natural remedies, or it could be medication created from or derived from natural things. And it's super amazing because this is the first big study that has been done. They did research by looking at all these amazing places. These are the current type of treatment that have been used earlier on, but they do not reverse the damage. They simply manage the symptoms, and the potential side effects are always there. So what can be done to make sure that we better off? Now I'll be looking at this interesting book, The China Study and How Not to Die. It talks about so many things, and when it comes to health and lung health, insight from these books are very helpful. I recommend them. If you can get them, please go buy and read the books. So why is it important? So antioxidant rich food and anti-inflammatory diets benefits the lungs and overall boosting your immune system that can make tremendous impact on your life and lung health. Some things apart from the natural things that we can eat is taking natural therapies for COPD, like breathing exercise in a specific way, deep breath, and lifestyle changes to improve your health overall. So there's so many amazing, and these are some of the daily habits I can recommend. Say, you know what, if you have, or if you may think you may have, or if you want to prevent, stay hydrated, avoid smoking, and stay away from pollutants. There could be different pollutants, not just smoking. There are other chemicals, things that you can inhale that could cause problem. Try to stay away from those things. And without a say, nutrition, diet, and exercise are very, very important. So keep that in mind, guys, and I know it's very important. And sometimes when you hear about health, we get to think, oh, I can do away with my medication, but actually this is a journey that's going on. They're still doing researches to understand what actually causes this problem, and while they are trying to find natural ways of healing it, I recommend that we put on the scale and use both with the advice of our doctor, physician. Like, how can I integrate the medication I'm getting to heal or help with my emphysema or COPD with my diet? Include a nice diet, exercise, sunshine, and all the things I've been discussing on this channel. Now, thank you so much for watching, and if you did get value in this video, please subscribe, and if you think someone may gain value from this, please share. And if you have a question, comment in the comment down there. We will respond. And thank you so much for staying with us. And as always, I've always promised that I will share with you what Nihaniraho stands for. I guess you guys can try to guess by the picture out there, but I'll be telling you more about Nihaniraho in the coming video. So stay tuned, and as always, if you get value in this, thank you so much for watching. Share, like, subscribe, and I wish you and your loved ones a healthy lifestyle, a productive one. Thank you so much. Have a good one. Bye.